Next on Healthy Montgomery Family Checkup. Cancer, it comes in many forms. We're going to take a look at some of those forms and dispel the 5 myths associated with breast cancer. Plus, we'll hear from a Montgomery County Council member as she shares her story of surviving cancer. Then we'll look at the controversy surrounding prostate cancer screening that's confusing men. To screen or not to screen? Is that the question? That and much more on this edition of Healthy Montgomery Family Checkup. Hi, I'm Kathy Fowler, and welcome to Healthy Montgomery Family Checkup. This is our first of 2 fall editions, and we're going to talk about a few of the most common forms of cancer, breast and prostate. Together in Maryland, those 2 account for nearly 1/3 of all new cancers. First, when it comes to breast cancer, there's a lot of information out there, but consider this, much of what you know may not be fact at all. Casey Taylor dispels 5 myths about breast cancer.
Kathy Connell was shocked 5 years ago when she learned she had breast cancer.
The first thing that came to mind was that they made a mistake.
Kathy had no family history of the disease. Dr. Mark Schachner says it's a myth that no family history offers protection.
Most people who do have a family history, it's just a coincidence that they also have breast cancer.
70% of women diagnosed have no known risk factors. A second myth is that all women have a 1 in 8 chance of getting the disease.
1 in 8 of women by the time they're 85 will have had breast cancer.
But a woman in her 30s only has a 1 in 233 risk of getting the disease. Myth number 3, a mastectomy is better than a lumpectomy. Not true.
We can't say that if you get a lumpectomy versus having your breast removed that you'll do better as far as cancer recurrence is concerned.
Another myth, smaller breasts decrease your risk of cancer. In this case, size doesn't matter. The last myth that's vital to dispel is that breast cancer always shows up as a lump.
Really, most breast cancers probably aren't preceded by a lump.
You should check for lumps, but also look for redness, swelling, dimpling, nipple pain, or skin thickening. Kathy did feel a lump, and it saved her life.
If I hadn't found my cancer when I did, I would be living a very different story.
Today, she's happy to say,
I am cancer-free. I'm cancer-free.
This is Casey Taylor reporting.
Still need proof? Montgomery County Council member Nancy Florine is the perfect example of the critical need of early detection.
It was a routine mammogram that set Nancy Florine's life on a new course. Stage 1 breast cancer, a lumpectomy, radiation, and regular checkups with her oncologist would be the protocol for the coming year.
And I still can't believe that I have breast cancer. I really don't think it's sunk in.
Today, 1 year later, she is cancer-free.
I'm good to go. I just had my 1-year checkup, soup to nuts, and there's no evidence of recurrence right at this point, so that's good.
When asked how her cancer diagnosis changed her, Councilmember Florine says today she pays more attention to what she eats and makes a point to exercise regularly.
We're learning the benefits of kale. My husband hates it. So I make him eat more leafy green vegetables. We're eating a lot more fish. We're trying to go as organic as we can.
Through her own regular visits to the oncologist during her treatment, Councilmember Florine learned of an option she decided would be a smart move in preventative care for her own family members: genetic testing.
I'm getting their advice as to whether to go forward based on my family's genetic characteristics. So we'll see what they say.
So just have a seat for me, and then as soon as she comes over, we'll get started.
After doing some research of her own and discovering a family history of cancer, she decided to go through with it.
So let's go on back. Okay, all right.
Dr. Judy Macon was Ms. Florine's genetic counselor.
Only about 5 to 10% of women who are diagnosed with breast cancer do have a genetic component. So what we do is we look for clues in a family to see, is this a family that is appropriate to consider testing? The thing I'm concerned about, I guess, on your mom's side of the family, is you had an aunt with uterus cancer and breast cancer.
For Nancy Florine, the discovery of aunts and cousins who had a history of cancer made the decision to undergo genetic testing an easy one.
But you do have a lot of family members. I must say, this side of your family is a little more suspicious than this side.
Two-time cancer survivor herself, Dr. Macon says this type of testing does not predict breast cancer.
Good afternoon, Suburban Hospital Cancer Program. This is Judy.
But does allow women to make more informed choices about their health.
So a lot of people come into this thinking, well, why should I want to know? You should want to know so that you can help reduce your risk of certain cancers the most you can. That's empowering. That's getting ahead of the game.
Over the past year, Councilmember Florine has made it her mission to make sure women remember to get their mammograms. She signs each of her emails with a reminder to do so. She says it's critical for women to stay on top of their health.
For women, that's an easy thing to skip, especially as you get older. You say, I've done all those tests, I've had those kids, I'm done with all that. And at least for the kind of breast cancer I experienced, I had no idea. It was only as a result of a routine checkup that this was found. And I think that's pretty typical.
The Cancer Control Center provides yearly breast and cervical cancer screenings free of charge for low-income, uninsured female residents of Montgomery County.
The resources are there. We've put quite a bit of money into community health here in Montgomery County. We're better than most in terms of our attention to this issue in the community. Ladies, right there.
Today, Nancy Florine says life is good. Though she may not feel completely back to her old self, she is grateful for where she is and how she got here.
Today, she's cancer-free due to a simple, routine mammogram. For more information on early detection and free screenings, you can find it online by visiting this website. Coming up, men's battle with prostate cancer and the confusion surrounding when or if to get screened.
Get more information and interviews on these and other issues at mymcmedia.org/health.
If you could see anything in the world, what would it be?
I'd love to see Paris.
I like to see cupcakes falling from the sky.
To save your vision in the years ahead, call your eye doctor for a comprehensive eye exam today. Then call 1-800-437-2423 or log on to seeabettertomorrow.org to learn about glaucoma and macular degeneration.
I just want to see more of the things I love.
In Maryland, more than 5,000 men are expected to be diagnosed with prostate cancer in the next year. Approximately 510 of those men will die from this disease. But will screening help men survive? One Montgomery County man says men need to listen to his story because he says he's living proof that screening works.
That PSA test really indicated that I had a problem. So I went through a biopsy, and the biopsy indicated cancer, and not only cancer, it indicated an aggressive form of cancer.
Jeffrey Love says he's a living example that the PSA prostate cancer screen saves lives, a message decades in the making. Once men hit 50 years old, they should get an annual PSA screen. The question if men should be screened just got a lot more complicated. The U.S. Preventative Services Task Force recently said that most men should not get routinely screened for prostate cancer, that screening could actually be harmful.
Prostate cancer got a lot of press recently for PSA screening because it went from a C grade to a D grade. A C grade means that there is conflicting evidence and that a conversation should occur between the doctor and the patient of the pros and cons of a screening test. A D grade means that there is harm done to the patient by electing to screen them with whatever test that they're discussing, in this case PSA.
Harmful because according to their research, the screen may lead to overdiagnosis of prostate cancer and aggressive surgeries with potentially harmful and life-altering side effects. And the task force report says it didn't necessarily result in saving lives.
The U.S. Preventative Services Task Force felt that there was enough information to say that this was harmful. And urologists, oncologists who were incidentally not included on that panel, disagree with that recommendation, because we think at the very least there should be a conversation between doctor and patient about the validity of screening. And I'll tell you that most urologists and oncologists believe that PSA screening does save lives from prostate cancer.
There's been serious pushback on these latest recommendations to stop most prostate screenings, from specialists like Dr. Bart Radolinski to primary care physicians. According to a recent Johns Hopkins survey, doctors responded by saying things like, "My patients expect me to continue giving yearly PSA tests." 66% of the physicians said it takes more time to explain why I'm not screening than to just continue screening. And more than half of those surveyed in the study believe that by not ordering PSA, it puts me at risk for malpractice.
I'm a living proof that it does help, and I think to have this blood test, step one. Of course, there's the other exam that nobody looks forward to, but is also a great indicator. But you couple these PSA tests together, and you link them together, and they really tell the story. And if it does rise, then I think it's worthy of taking a next step. Nothing's an absolute indicator, but if you don't do it, you could potentially lose out. And I tell you, if you lose out with this disease, you may not be around too long.
There aren't a lot of symptoms of prostate cancer, especially in the early stages. Prostate cancer, before we had PSA testing and screening protocols, was often detected when patients had significant amounts of blood in the urine, or weight loss that they couldn't explain, pain in the large bones or joints, or sometimes inability to pass urine at all. This was essentially too late.
So the answer, to screen or not to screen?
I believe in screening, so when patients come in and they meet the criteria, I recommend getting a PSA test.
I think that did really save my life, because if I would have waited until this thing went over 4, heaven knows how far that cancer could have spread.
It's especially crucial for men at high risk to get screened for prostate cancer, men who have a family history of prostate cancer, and all African American men. Now, the one thing that's not controversial, men need better prostate cancer screening tests. In the U.S., researchers are working on 2 new tests, and as Andrew McIntosh reports, they are promising better results to hopefully save more lives.
Prostate cancer. It's the number 2 killer of men, second only to lung cancer. 1 in 6 men will get it, 1 in 36 will die from it. Those numbers haven't increased or decreased in the last 10 years, but how the cancer is treated has changed.
Mine was a more aggressive form, or appeared to be a more aggressive form of prostate cancer.
A PSA test is what most men get to determine their risk, but Dan Zenka found out he had prostate cancer through the next generation of tests, a pro-PSA test. PSA is found in the blood. High levels could indicate cancer. The new test measures 3 different levels in the blood. Combined with annual biopsies, it was 70% accurate in singling out tumors.
It can give you a more accurate estimate of whether or not he has prostate cancer.
Meanwhile, researchers at the University of Michigan believe a new urine test is more accurate.
PSA, you have to understand, stands for prostate-specific antigen. It actually is not specific for cancer. So when your doctor says it's abnormal, it could be because you have an enlarged prostate, prostate inflammation or infection, or cancer.
The urine test works by identifying gene fusions that occur when pieces of 2 chromosomes stick together. These fusions are common in prostate cancer. The urine test identified 80% of patients with it.
It's actually going to make my life easier. If it doesn't put me out of business.
2 new ways to detect a killer earlier than ever before. I'm Andrew McIntosh reporting.
Men are more likely to die from any illness than women, in part because they aren't as likely to go to the doctor. Let's look at some of the stats that will hopefully convince the gentleman out there that going to the doctor isn't so bad. In the U.S., over 5 million men have been diagnosed with some form of cancer. The leading cancer is prostate, then colon, lung, and finally skin cancer. In comparison to breast cancer in women, nearly 30% more men are diagnosed with prostate cancer, with over 4% more deaths. According to the Centers for Disease Control and Prevention, more men die from cancer, heart disease, injuries, stroke, and diabetes than women. However, they are half as likely to go to the doctor for annual exams and preventive care. So, gentlemen, call your doctor today and make an appointment. We hope this edition of Healthy Montgomery Family Checkup was educational and informative. For more information on these and other health-related topics, simply visit one of these websites. We'll be back next time. Until then, I'm Kathy Fowler, and stay healthy, Montgomery.